So, uh, good afternoon. Today, I'm just going to take the session related to anatomy and physiology, cardiovascular. So, you know very well, as a wide area, cardiovascular system is a wide range area, and we should definitely know the basic core aspects of cardiovascular. And first of all, the basic things means what about the heart structure? Heart is a conical structure, isn't it? It's a roughly cone-shaped hollow muscular organ. You can see here in the figure. I just mark each and every part of the cardiovascular system here. It means heart here, mentioned here. And length is approximately 10 centimeter. Textbook get varying the size little bit, 0.5 or zero point 0.3 like that. So length is 10 centimeter and weight is 225 gram in women and 310 gram in men. And this is about the basic concept and thing. And about the position and location, first of all, the heart lies where? Where's the location of the heart? So this one is lies in the thoracic cavity, in the mediastinum, the space between two lungs, in between two lungs. Okay, lies in between or in the thoracic cavity, in the mediastinum, the space between the lungs. So it oblique a little more to the left side or left than the right, and the present base above and apex below. Base above and apex below. So here, generally you can see a lot of thing inferiorly, what all things are there, superiorly, what we can able to find out, and posteriorly and laterally, then anteriorly, how the heart structure is. Inferiorly, the apex rests on the what central tension to the diaphragm. So apex part, here you can see your arch-like diagram, that is diaphragm, and superiorly the great blood vessel. Which one is our great blood vessel? Is aorta. Then superior vena cava is there, pulmonary artery, pulmonary vein. You can see this on superiorly. So main blood vessel or great blood vessel aorta. Then superior vena cava, pulmonary artery, pulmonary vein, all those composition are there in superiorly. And about the posteriorly, you can see esophagus, trachea, then left and right bronchus, then descending aorta, inferior vena cava, then thoracic vertebrae, all those things are there posteriorly. So inferiorly, already I said the apex which is rest where on the central tendon of the diaphragm. Then related to superiorly great blood vessels, remember about the aorta, superior vena cava, pulmonary artery, pulmonary vein, all those things are there in superiorly. Then about the posteriorly, esophagus, trachea, then left and right branch, bronchioles, bronchus, not bronchioles, bronchus, then descending aorta, inferior vena cava, and the thoracic vertebra. Sorry. Laterally, the lung. The lung means the left lung overlap the left side of the heart. Left lung overlap the left side of the heart. And remember one more thing, that is anteriorly the sternum, rib, and intercostal muscles. Then structure of the heart, you can see here the structure of the heart valve. This heart valve composed of three layers mainly, or three-layer tissue. So you know very well about the three-layer tissue is pericardium, myocardium, and endocardium. Pericardium, myocardium, and endocardium. You know very well because this composition or this compose or the thing related to the three layers are very important while we are studying from the small class itself. And next to that, you should know about the pericardium. What is this pericardium? Pericardium is the outermost layer, this covering of the heart, and this made up of two sacs. And that two sacs, outer sac is fibrous tissue, and inner sac consists of double layer. What membrane or which membrane? Serous membrane. Okay, outer sac is fibrous tissue and inner sac with serous membrane. And outer layer is parietal pericardium, and inner layer is visceral pericardium. There is a space in between parietal and visceral pericardium, and the space is occupied with 50 ml of fluid, less than 50 ml of fluid. If it is greater than 50 ml, by the way, it's not happen naturally. If it may be occurred due to a blunt trauma or a forceful hit. So what happened means, by the way, the space occupied between the parietal and visceral pericardium, if the fluid is increased that area due to a blunt trauma or injury, it lead to cardiac tamponade like emergency condition. So it's not important here. Now it's an emergency case that we will discuss later. Okay. The space between the two sac is known as pericardial space, which is filled with a serous fluid, and which is secreted from the serous membrane of an inner sac. So now about the layer which we are discussing here, the pericardium. Pericardium is the outermost layer of the heart and made up of two sacs. An outer sac which consists with what is a fibrous tissue. An inner sac consists of double layer membrane or serous membrane. Okay, outer layer is parietal pericardium and inner is visceral. There is a space, that space occupied with a serous fluid. Remember that in a simple way. Okay, and next to that is about the myocardium. So myocardium, you know, but the muscle layer is a muscle layer found only in the heart, and it's not under a voluntary control. It's a straight like skeletal muscle. And each fiber cell has nucleus, and this one is consists with more than one or two branches. And this is about the myocardium. Should know about this all things. And myocardium is the thickest. I mean, what happened means is the apex part. So this apex part become a little bit thick. Don't forget about that and wait for a second. So this is related to the what we're discussing about the myocardium. Remember about the myocardium about this. These are the important point of myocardium and pericardium, myocardium, and the next one is related to endocardium. So you know the endocardium, this lines a chamber or a chamber and valve of the heart. So it's thin, a smooth membrane which is present in the endocardium. So it helps for the smooth flow of blood, and it consists with the flatal epithelial cells and continue with endothelial lining to the blood vessel. And then you can see here, you can see superior vena cava valve and aorta, left pulmonary artery, pulmonary trunk, right atrium, and each and every part here just mark it for you, easy to understand. And about the circulation of the blood through the heart, in a simple way, just explain valve and everything is there, four valves are there, but you can first of all check it out here. Superior vena cava and right atrium to tricuspid valve, it reached to right ventricle, then via pulmonary valve, it reached to pulmonary artery, and from pulmonary artery reached to lung, run to pulmonary vein, then left atrium via mitral valve, which reached to the left ventricle, then aortic valve reached to aorta and rest of the body. So this is about the circulation. In circulation in simple way. And about the valve, right side AV valve, three flaps. That's why we call it as what? Tricuspid valve. Three valve. Right side three valve. So that's why we call it as tricuspid valve, which separate right atrium and right ventricle. That's why you can see tricuspid valve here. From superior vena cava, it entered the right atrium. From right atrium, tricuspid via tricuspid valve, it reached to right ventricle. The blood reached to right ventricle. And left side, what we can see, two flap valve that we call as bilateral or bicuspid valve, which separate the left atrium and left ventricle. So left atrium and left ventricle is separated by which valve? You can access very easily. It's bicuspid or mitral valve. Right side valve, three flap is present. So that is the tricuspid valve. Then coronary artery circulation and something heart sound is very important. S1 as lap, which occur beginning of the systole, and S2 is dub, a start of diastole. S3 is gallop. S3 is normally, we can say it's not a normal rhythm. About 35 years, if the person is having something like congestive heart failure, can rule it out S3. It's just like a mama. Okay, gallop is an abnormal rhythm. So S3, S4 is also like that only. When we can able to rule out S4 means pulmonic stenosis, or those who are having this aortic stenosis, severe hypertension, MI, or there's a chance for occur for cardiomyopathy. So like this cases can able to find it out S4. Not always. S3 related to congestive heart failure, and S3 related to congestive failure, and S4. S4, what means S4 can able to find it out with the cardiomyopathy and certain cardiac cases. So can able to rule out with certain cases. So these are the major things. And heart rate, heart increases, the rate increase the oxygen consumption. Then a normal sinus rhythm, already everyone very well know about this, 60 to 100 beats per minute, and sinus tachycardia means more than 100 beats per minute, and brady less than 60 beats per minute. Remember, and about the heart chamber, there are four main chambers. There: right atrium, right ventricle, left atrium, left ventricle. Right atrium size is 2 to 3 mm in size. Right ventricle is 4 to 5 mm in size. Left atrium 2 to 3 mm, and the left ventricle is 10 to 15 mm. Left ventricle size is high. And blood flow, already we discussed about the blood flow. I think, did I want to repeat? I don't know. So about the blood flow, the two largest vein of the body, superior vena cava and inferior vena cava, empty the constant into the right atrium. So the blood passes via right atrioventricular valve, where it reached right atrioventricle, and from the blood is pumped out to the pulmonary artery, the only artery in the body which carry deoxygenated blood. So deoxygenated blood which is carried by pulmonary artery. Just remember about that. And the opening of the pulmonary this artery, or this pulmonary valve, this is present, which prevent backflow of the blood. That's why it get closing. Otherwise, what happen means regurgitation is everything like aortal means atrial insufficiency or ventricular insufficiency, or some conditions. A lot of conditions are there. Mitral insufficiency, or pulmonic stenosis. Lot of conditions are there. While we start to discuss about the cardiovascular system, so much things are there. After leaving the heart, the pulmonary artery divide into left and right pulmonary artery, which carry the blood to the lung, where exchange the gas take place. Carbon dioxide excreted and oxygen get absorbed. So basic things like where the purification, after purification of the blood, which is happening in the lung, to pulmonary vein carry oxygen back, or oxygen-rich blood back to the left atrium. So this is a little bit simple while compare what I'm seeing. Okay, so blood then pass through the left atrioventricular valve, that means bicuspid valve. So what happened means into the left ventricle, from the blood is pumped out into the aorta. So the first artery of general circulation is aorta. So the opening of the aorta, this is guarded by aortic valve. At the opening of aorta, there are valves present which are semilunar or aortic valve. Like, so in simple, that's why superior vena cava, inferior vena cava, it reached to right atrium, then tricuspid valve, via tricuspid valve, it reached to right ventricle, then move on with pulmonary valve to pulmonary artery, from pulmonary artery to lung, then pulmonary vein, right atrium, mitral valve, left ventricle, aortic valve, aorta, from aorta, rest of the body. Like, so blood circulation to the heart is very, very important. And coronary circulation There are two coronary artery mainly, right coronary and left coronary. So arterial supply, the heart supplied with atrial blood by right and left coronary artery. So the coronary artery branch from ascending aorta, and this coronary artery receive about 5% of blood pump from the heart. So large amount of blood supply, especially to the left ventricle. There are two coronary artery mainly. We are discussing right coronary artery and left coronary artery. So that is important. This right coronary artery, it supplies small branches to right side of the heart. And right artery having two branches. This marginal branch and posterior interventricular branch, which supply to all wall of the two ventricle. Marginal branch supply to where means marginal branch supply blood to the right ventricle. And about the left coronary artery, left coronary artery, you can see right and left coronary artery, you can see here. So left coronary artery pass inferior to the left circle and divided into anterior interventricular branch and circumflexus branch. So anterior interventricular branch will supply blood to wall of both ventricle. So circumflex branch which supply oxygenated blood to the wall of the left ventricle and left atrium. Like then venous drainage, most of the venous blood is collected into number of cardiac vein. The joint form the coronary sinus which open into the right atrium. So here just mentioning everything like coronary circulation, right coronary and left coronary and right supply where and left supply where, like it divided into two, like and heart rate and a vascular system artery. You should remember know about the artery, what about the arteries are doing or performing, then arteriole, capillary, venule, vein, and about the valve. Lot of things are there. And artery are the blood vessel, what they are doing means which blood passes away from the heart to various part of the body. The highly oxygenated blood from left side heart to tissue. Then arterial means which is controlling the blood flow into the capillary, and capillary they are exchange the nutrients into the or between the blood and interstitial space. Then venule means receive the blood from capillary blood or capillary bed and blood into the vein. Then vein transport deoxygenated blood from the tissue and back to the right heart, then to the lung for oxygenation. Then valves are here. Valves help to return blood to the heart again the force of gravity. Lymphatic tissue means drain the tissue or lymphatic system drain from the tissue and return to the tissue fluid to the blood. Means waste is removing the things. An exchange happens. The lot of diagnostic procedure are there like CKMB, TROPI, TROPT, myoglobulin, complete blood clot, serum lipid, cysteine, homocysteine, highly sensitive C-reactive protein, electrolyte. So much things are there. Blood blood urea nitrogen, blood glucose, beta, natriuretic, like a lot of things are there. So with this small topic, it's like here I'm just winding up. Like, thank you.